Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave a comment. Let us know what you think. Here at Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I have the very great pleasure of welcoming Dr. Sharoy Hodges out of Pensacola, Florida. Dr. She's an experienced nursing professional. She's the Nurse Residency Program Coordinator at Baptist Healthcare in Pensacola. She says she is passionate about preparing nurses for the real world of practice. And she says the messy, meaningful, patient-centered moments that shape careers. She believes nursing is rooted in service, advocacy, and compassion beyond technical skills. So welcome, Dr. Hodges.
Thank you so much for having me, Miss Dale. I appreciate it.
It's my absolute pleasure to have you. My pleasure. Before I even ask you my first question, I have to tell you that when I looked at your bio and you said preparing nurses for the real world of practice, and you started with messy, I laughed out loud. I laughed.
Yes,
I
yes,
could,
yes, yes.
I couldn't have said it better myself. I thought, yeah, exactly, exactly, exactly. But why are you a nurse? What brought you here?
If I'm being very transparent, I won't say I fell into nursing. I will say God placed nursing in front of me. When I showed up, I graduated from Florida A&M University, and I selected that university because of the pharmacy program that they had. It was the number one for pharmacy. And I got there and, bright eyed and bushy tailed and 19 and just ready to take on the world. And I got there and I had to declare a major. And before declaring the major, I said, well, I probably should look at the classes that I have to take. And I looked at the classes and I said, nope, not gonna do that. And then I looked over in the next option or category and it said nursing. And I was like, oh, let's try it. Let's try that part. Um, as when I was younger, I will say my mom spoke a lot about how she would have, should have, could have went to nursing. But of course, life happened and
Yeah.
things just didn't work out that way for her. So I think those were kind of the two realms that's gotten me into nursing. It was never like a childhood dream and I hear my residents say, oh, I wanted to be a nurse since I was little bitty or since I've taken care of Gram or Pop or whoever. But no, it just kind of it fell. He put it right here, and that's how I got to where I am.
All right then. So this was like maneuvering you into this. What challenged you?
Everything. I I was I got out of I graduated, passed my boards, and my first job was on a med-surg floor. And when I tell you I was not prepared for what I walked into, my school, I will say, did a wonderful job on just being very direct and straightforward. The educators, the professors I had were not warm, cuddly. They told you straight out what it was going to be, but still you think, "Oh, I'm going to have time to just hold hands and, make eye contact and be with one patient for hours at a time because that's how it was in clinical and that's how I did it with my preceptor." And it was just a very fast reality of the young lady who trained me. She was older, a little bit older than me, but she was shorter. She was a short girl and she was ex-military. And she was just said, you better keep up, you better keep up, you better keep up. And I went home every day crying. Every day I went home crying. And I told my parents, I was like, this was a terrible decision. I don't know what I got myself into, but looking back, even now, I very much appreciated how she trained me. I very much appreciated the things that I saw on that floor and the skill set that I gained because I think it helps me A, speak to it to new graduates now.
Mm,
And B, I tell them all, I said on a med surg floor, you're gonna learn well more than you want to learn.
yeah.
You're gonna learn well more than you bargained for. And I attribute it to um, with MedSurg, it's such a looked down spot to start. Everybody wants to
Mhm,
start in the
mhm,
glamour of ER and
mhm,
ICU.
mhm,
But I tell my graduates, it's like if you can make it on MedSurg, you can make it anywhere. MedSurg is your
mhm,
New York. If you can
mhm.
make it there, you can make it anywhere.
Yeah.
And once you get that mentality, it's going to carry you the rest of your career.
Yeah, yeah. I've never heard it compared to New York.
But you think about it, everybody knows, oh, New York is so rough and tough and it's this
Yeah,
and that. But when you make it there, you can go anywhere. You got it. And that's in my head, that was what med surge was. It was my New York. So
So, so okay, so you started in med surg. What other areas did you work?
after med surge, I actually left the floor because my husband and I had recently gotten married, and my husband and I had decided that we wanted to start our family. And one of my I guess, hard and fast rules was I did not want to be pregnant while working, turning patients, lifting patients, pulling things like that. So I opted out to leave the floor, and I was another God just dropped it into my lap. I wasn't looking for it at all, but it happened. I ended up being a nurse. They called it a clinical care coordinator, and I was the nurse. I was one of four nurses who worked along with 30 physicians, and each of the nurses had their group of doctors that they were responsible for wrangling, and it was still inpatient. We rounded with our physicians, we rounded on them while they saw their patients. We made sure all of their follow-ups and insurance and all the things were done on the backhand side to prevent readmissions. And that job was probably one of the best jobs because it allowed me to have a consistent schedule while being pregnant, and then after we had our baby. um, I loved it. It was no weekends, it was no holidays, and I still got to be in patient care. I still got to
Yeah,
be on the floor. I still got to be at the nurse's station. I was always very scared about losing my skill set and losing the verbiage and the terms. And
yeah, yeah, yeah.
but I was able to still be in the middle of it. And oh goodness, I did that for about 4 years, um, until again God dropped education into my lap. And because if you would have ever told me back in 2011 that I would be teaching anybody anything, I would have laughed hysterically. But I ended up in education, I think in 2018, and I have loved it probably a little bit more than patient care. I
Mhm.
love prepping the people who are doing the work, and I've just enjoyed it, and it still allowed me. Now we have another child, so it has allowed me to have the consistency for my girls. My husband's schedule and my schedule align, so it just has worked out very well for me.
That's awesome. That's truly awesome. And so, well, okay, I was going to ask you, but let me ask you this though. What what would you say then you see as the biggest challenge for nurses coming into the residency program?
No one thing specific, but overall, I can say, and you and I kind of talked about this briefly, nursing education has changed substantially. And I'm sure COVID had something to do with that. Things had to be
Mm-hmm.
realigned and reassessed and reevaluated just to make sure that we had nurses coming through the pipeline. However, COVID is now over, things have passed. The teaching hasn't reverted back to what it used to be. It is still on the let's get them through, let's get them through. A lot of my nurses are coming out just very unaware of what they should expect in a real life, real acute care setting, where I tell them the three things that they're going to struggle with the most is going to be time management, prioritization, and delegation. While you're in clinical, you have one patient, maybe two. You get to pass a pill or two. You might get to check a blood sugar. And then the rest of the time on that 8 to 12 hours that you're there with your instructor and the rest of your classmates, you're kind of just looking through your assignments and looking through your med
Yeah.
search book. Well, when you get here at 7 a.m., maybe 6:45. You hit the ground running from the time you get here to the time you leave.
Mm-hmm.
And you are every patient's everything. You are
Yes.
responsible for everything that's happening. And I don't see a lot of the schools able to prepare their students for that reality, which makes it very challenging because when they get here and they realize that it's a struggle, they end up leaving.
Yeah.
And they just don't leave the bedside, like they leave the profession. Like they go to
Mm-hmm.
sell cars or sell insurance or something of
Yeah.
that nature.
Yeah. Yeah.
And I think that's
Mm-hmm.
harming the profession in totality. Overall, it's being
Yeah.
very hurtful to the profession.
Yeah. 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 Because their confidence is destroyed,
It is.
and
It
so
is.
they
And it's
leave.
very challenging to rebuild that excitement and rebuild that confidence after it's already been hit, sometimes
Mm-hmm.
multiple times.
Yeah.
Um, so I will say, at least in my role, a lot of residency is, yes, you do your clinical skills and you learn how to do your techniques and all those things, but you learned all that stuff in the med-surg book. I told them, you guys have already passed the test, so we've already done all that stuff. But a lot of it is just talking through the anxiety, the pre-shift and the post-shift anxiety that nobody talked about in school
Oh.
that you would have, the anxiousness that you feel driving into work and leaving work. Did you remember to chart everything? Did you tell everything in report? Did you make sure you got back to that patient? They don't go over that part in school because a lot of that is just psychological safety, honestly.
Yeah. 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 And you're talking about the anxiety. I really would like to do a I think I would like to do a study just to see where our cortisol levels are all the time, because I am convinced that they're like,
You got to get everybody to do fasting labs. They got to get those levels drawn before 8 a.m. And I want to see what their steady base is.
because I'm telling you, we are constantly, and the problem with that is that, we actually do stay in that state for a lot of time. You don't
Hmm.
even know you're in that state.
Nope. Nope. And now God built us to be in that state, of course, just in case, the
Hmm.
ground opens up or something occurs, but to stay in it at a constant 24 hour, that's not good. And a lot of them they experience it on several levels. I had a young lady um, about 2 or 3 weeks ago crying in the middle of report, just so anxious and so wound up because she didn't want to be wrong and she wanted to make sure that
Hmm.
she had
Hmm.
everything figured out, just tearful in report.
Yeah. Yeah.
And it shouldn't be like that. That nobody wants to be in a job where that's how you're feeling going in every day, my word.
Yeah.
But I don't know. I have not solved this mystery on how best to prepare them prior to getting into the acute care setting.
Yeah. 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 And the thing is, you talked about, you know, the young lady crying during report, but report is high anxiety time, because God forbid somebody challenges something you said or you perceive it as a challenge. Your day
Hmm.
is shot.
Yep. Yes. Especially if you don't have the answer to what they're challenging, or you don't know why they're challenging, or is this important? Did I miss this? Should this be important? Am I the incompetent one? Is she
Yeah,
challenging me or he challenging me because I'm new, I'm young?
yeah, yeah,
It's a lot of factors that go in, and then your self-doubt starts to kick in, and that's where your confidence just starts to sink downhill.
yeah, 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 exactly, exactly. Anyway, but talking about, I ask you this though. We're talking about you being you're doing the residency program and all that. What excites you the most? Because we just talked about the things that you see that you wish you can change, but really, what excites you?
I This is gonna sound terrible, but I love just getting under their skin. I'm a jokester by nature. I use humor in a lot of things. But when you have a class where they come in and they think they've got it all figured out, right? They know they got it all figured out because for whatever reason they think they have these letters on their chest as RN and it just they've got life grabbed. I love to create a patient or develop a scenario where it leaves them just looking like, I don't know what to do. And I often and even my managers and my directors are like, oh gosh, you're so mean. I say I like to just poke the bear. I just like to poke the bear. And but I want you to look at this patient not from what the med-surg book says, because we're done with the book. You got to look at this as a whole. You got to
It's
look
in
at
front of
this
you.
in non-black and white, because a lot of them come out of school because school trained us all. What did the
Yeah.
book say? What is the rule? But I said, a patient's never gonna, you're never gonna walk into a patient's room and have all the information presented in front of you. And the patient's never gonna tell you, okay, this is what's going on. These are my vitals. This is what my lab work looks like right now. I think I might have a high lactic, but you're gonna figure that out in a
You
minute.
know,
No patient's gonna tell you that. So I like to present or create situations as to give them an opportunity to think outside of the box, if that makes sense, if
yeah,
they
that
can.
makes perfect sense. It makes absolute perfect sense because, as you just said, it was so very important because, as you just said, the patient is not going to tell you what you actually saw written in the book.
They're going to be everything opposite of the book, actually.
Dear, dear. But speaking of that though, nursing is evolving. It's evolving, we talk about how AI is evolving, but nursing is evolving just at the same pace as far as I can see. So
Yes. Yes.
what do you think you see nursing looking like in about 10 years?
I don't know, but I'm scared. I I do not know. I am at the age where I'm having to check on my parents. My parents are my dad is um, in his lower 70s. My mom is in her upper 60s. And they're at the point now where they're coming into the hospital. They're having procedures, their knees and hips or whatever. I'm having to be the person, not the nurse, but the daughter speaking to a nurse. And my prayer is that the nurses taking care of my patients or my parents are both competent and comfortable in the skill sets that they have. I implore each of the nurses to think of every patient you take care of like you would want that to be your own parent or whoever you care about. Some of them are like, oh, I don't like my mom. Well, somebody that you care about. Make sure that you are giving that patient the same level of respect, the same level of courtesy, the same level of care as that you would expect your own parents to receive. So, if we're looking at 10 years from now, I would hope that the practice is still continuing to evolve. We still have a huge dedicated pipeline to come into the profession, but we're also making advancements in the care that we give, how we do things. We should never be in the predicament where, oh, this is how we've always done it. So this is what nurses do. No, nurses can do so much more than pass your pills and give you a shot.
Mm-hmm.
We are competent individuals and we have a profession that speaks highly to the nature of our individual persons. So in 10 years, hopefully the robots don't take over by then, but if they do, they're helping nurses, they're not replacing nurses. That's what I would hope.
I know. And that's something that's a mindset that we really have to adopt is that, the assistance, their assistance.
Their assistants. I actually created some curriculum on just called AI in nursing in general. And a lot of new grads, they use these AI tools to help study for their tests and what have you. And a young man told me a few weeks ago, he said, well, chat got me through, my nursing school and my NCLEX. I said, well, that's going to be wonderful when you have to appear in court and you can tell the attorney that you educated your patient based on what chat GPT
Chat.
said.
Mm-hmm.
Like it's a helpful tool if you use it the right way, but
Yeah.
it's riding a very thin line on your license and the
Yeah.
safety of your patients.
Yeah. Yeah. The one thing I equated to fire, I remember growing up as a child, and when they don't want you to play with fire, really.
Hmm.
But I remember my grandmother telling
Absolutely.
me that, fire is a good servant, but a bad master. AI is exactly the same.
It's I like that, Miss Dale. I'm gonna take that. It's a good servant but a bad master. If it,
Mhm.
and I told them also, chat is only as good as the information we put into it.
Yeah.
So if you got a bunch of folks putting in bad information, it's gonna pull bad
It's
information.
gonna provide information. Yeah,
You're the
exactly.
human. You're the licensed one. So you still have to, you might have to read. I don't, oh goodness, you might have to pull up something and double check it, but you can utilize it, just not when it comes to your actual
Yeah,
steps in your patient
yeah.
care.
Because at some point you're still gonna have to answer the question, what would a prudent nurse do?
Exactly. What are your next steps? And I tell them, if you've never been deposed, a deposition is not fun.
It's not.
So if you have an attorney asking you, oh, so is it evidence-based practice for you to educate all of your patients using ChatGPT? I hope your answer is no. I hope you say no, and then you explain the platform that you are provided, but only time will tell.
Yeah, yeah, yeah. And speaking of that, you know, um, early in my career, looking at things, and being or thinking that I might be in a legal space was, something very, it was remote. If that were to happen, it would have been because like, something really drastically bad happened, right?
Right.
That perspective has changed. The chances of you being deposed, being in legal space, being on the other side of this are greater than ever.
It seems like it's almost not expected, but definitely happen more
It's
often than
it's
it
it's
used to.
yeah, absolutely, absolutely, absolutely.
And that's a scary. I have not ever been deposed, but I've worked with nurses who have,
Yeah,
and it is definitely not an experience that I would put on anybody. When you have to, you know, I can't even tell you what I did last weekend, much less what I did 14 years ago at the bedside.
exactly,
Mhm.
exactly, exactly, exactly.
And that comes to play heavily with their charting.
Mm-hmm.
A lot of them come out a little bit more lackadaisical than I would like when it comes to charting, but then they learn as they progress in their time in their unit what is definitely needing to have your attention and what doesn't necessarily need to have all of your attention. But the charting is it's looked at, and they're going to turn every rock, they're going to turn every pearl, and they're going to find out what happened.
Yeah, 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 exactly, exactly. So what is your biggest advice for someone going into nursing?
Make sure you have a good understanding of what nursing is. And by that, I mean, please do not let TikTok or Instagram or any other social site tell you what nursing is. I would hope that you would talk to a nurse and get their actual perspective versus letting um, social media explain it or glamorize it or demonize it to that extent, and have a very firm understanding of what you're walking into, because I think, as I said earlier, the expectation is not fully there.
Yeah,
They're not exactly prepared as to what the job all entails, and I think a lot of that brings on the shock factor.
yeah,
You've done all the work, you've done the trialing, you've done the testing, you've done the papers, you get the job, and then you're in the romanticized phase of it. And then as soon as you have that first situation, the shock hits and you're not exactly sure where to go from there.
yeah.
So please do your research and don't let someone on social media tell you what it is.
Yeah. And don't get carried away with the cute scrubs either.
Oh my, oh, you took it out of my mouth. I didn't want to say it, but you did so much. And I see them and they're so excited. And the first thing they do is go buy a set of scrubs and they stand in the mirror with their little buddies and they take pictures and I'm happy that you're happy, but that is not the job. Like I hope the scrubs are you can move in them because you're gonna be all up and down the hallways in them. So just get some real life discussion about it.
I am happy that, as you said, that you're excited about the job. I really am. But the reality, and maybe that's one of the reasons that reality hits so hard because the excitement level is up here, and then like, oh,
It evaporates. You just see it kind of, the deer in the headlight look. We do a discussion on palliative care and hospice. And, I come in, I'm like, all right, who's ready to talk about dying? And they just look like, oh, people are
yeah,
gonna die. Yes, people are gonna die. Are you prepared for that? No. Have we dealt with hospice? Have we dealt with palliative? Have we dealt with
yeah,
grieving family members? Are you prepared for that? You can't be falling apart with the family member. You can do that in the bathroom or in the stairway, but not at the bedside. I genuinely I did have a class who just seemed to be very surprised that patients were going to die, whether it's expected or non-expected. That is a portion of the job.
yeah.
um, but then you'll have the nurses who are just so excited and they want to go to mother baby because everything is always happy in mother baby, and I was like, that is absolutely not the case, because you will have poor outcomes in those areas as well.
Babies
So
die.
babies die, and babies come out addicted to certain substances, and babies are taken away from their parents, and it's not always just rainbows and butterflies for everybody
Yeah,
that leaves here.
yeah, yeah, yeah,
And I'm
yeah,
sorry, at 22, I was not prepared to take on that type of emotional
yeah,
baggage. I
yeah.
just wasn't.
Nothing
So
prepares you for that.
absolutely not. And I don't want to discourage anybody's dreams. That's not why I'm here, but I also just want to be very realistic at what you're walking into, and just to give yourself some time to build up your profession and your skill set before you put yourself in those situations and then they don't pan out the way you expected them to.
Yeah, 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 yeah. And it makes it hard. You know what that leads me into though? Really? I was about to, but that leads me into self-care because are we teaching people to take care of themselves?
I do a small snippet on self-care, and I'll tell you that came after COVID, where we had a we had a very high percentage of nurses who were becoming addicted to substances, alcohol,
Hmm.
whatever their
Hmm.
choice was. We had a high percentage of nurses who were committing suicide, and
Hmm.
not, just this facility or that facility. This was nationwide. So that put the spotlight on what are we doing for self-care. It's easy some days to come in and smile, but it isn't easy to all days to come in and smile. You got to leave your own problems and your own situations on the back burner to take care of somebody else. But those problems and situations are still waiting for you when you clock
Exactly.
out. So I do make it a habit of asking my classes, what does self-care even look like?
Yeah.
It's one of those terms like burnout. I feel like we use
Yeah.
it a lot, but we don't really pay
Yeah.
attention to it.
What does it
What
mean?
does that mean? But they all come out and they're ready to work. They just want to work, 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 work. And I said, okay, when do you sleep? When do you spend time with your children? When do you go running or to the gym, or whatever your outlet is? Because yes, we're here to work, but we're also here you got to rest at some point. And again, at 22, 23, 24, they're like, oh, no, who needs sleep? I can do this and that. I'm like, I don't care if you can, but you definitely need to. That's a scientific necessity is that you have to rest. Because if you don't rest, I tell them that's when your mistakes happen.
Yeah.
That's when you're sleep deprived and you make your med error, or you chart on the wrong person, or you don't do a timeout and the wrong person gets the wrong procedure.
Yep.
You create opportunities to put yourself in situations that you shouldn't need to be in.
Yeah. 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 And things happen that you just never forgive yourself for, which
Nope.
wasn't necessary.
Depending on the outcome, it will be very challenging for you to forgive yourself if
Yeah.
like you said, if you can.
Yeah. 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 And you mentioned substance abuse and all of that. And that is something that we do not talk about a lot in the profession, about the unfortunate choices. And I said unfortunate because I couldn't find the word I want, that we sometimes make. And it's not what's the word I should say? The percentage of us who are making poor choices is not as low as we would
It
like
is
to
not.
believe.
Statistically, I reference this in class. Statistically, 1 in 7 nurses in their career, 1 in 7 nurses will be caught diverting drugs, diverting medications. 1 in 7. I feel like that's a lot.
It's a lot. And what that means is that every nurse will know a nurse who did that.
Yep,
Everyone will know at least one.
at least one. And it's not always the nurses, the young and new and inexperienced. It's not.
No,
It is
no,
various age groups.
yeah.
But like you said, each of us will know at least one nurse who has felt it necessary to take that route for
Hmm.
whatever reason.
Hmm.
And that's really sad.
It's
And
sad. It's
whether
sad.
it's them themselves who have the problem, or maybe they are passing the drugs on to a family member or a spouse who has the problem. But yeah,
It's
one in
sad. It's
seven.
sad. And it tells me that we have a gap in our um in the way we support our nurses.
Absolutely. Absolutely. I think there is a lot of hospitals nationwide. I think there is a lot of focus, and I did my doctoral project on this. We put so much focus on new grads. They're like the new baby. Mom had a new baby, so
Exactly.
we're going to give all the attention to the new baby, the new baby, the new
Hmm.
baby.
Hmm.
But you have older children, you have other nurses,
Yeah.
more experienced
Yeah.
nurses who also need support.
Support.
And I think as a profession, we could do better with that.
Yeah. Yeah. All right. Let's lighten this a little bit. What do you do for
Absolutely.
you? What do you do for you?
For self-care, man, I make it a habit. I go into the nail shop every 2 weeks. That is a rule. That is 2 hours. That is absolutely mine. I don't take the girls with me. Um, and then I stop either on the way to the nail shop or after the nail shop. It's either going to be a Chick-fil-A or a Starbucks. And that is just a minute to where I can kind of just decompress. The older I've gotten, though, um, I have been more engaged with audiobooks. I was able to do 17 audiobooks last year. So this year, my goal is to hit 20, just to get through 20 audiobooks. And that's just honestly just a minute to where I can kind of sit and be engaged in someone
Yeah.
else solving the mystery or putting the
Yeah.
puzzle together.
Yeah. I get
But
that.
it's just I can just kind of zone out, and I can listen to it while I'm folding laundry, or I can listen to it while I'm laying down. Either way, it works.
Yeah. Yeah.
What
Yeah.
about you,
Yeah.
Miss Dale? What is your self care?
Oh, there are things that I love. I love tea. So if everybody who knows me knows that I love tea, and so I have all kinds of tea here. People keep giving me tea, and I say, yes, bring it on. I love tea. I love to walk. I love to be outside, and I love to walk I love water, so I like to walk close to the water. I'm fortunate enough to live fairly close to water, so that works for me. And I love to garden.
Really? We are polar opposites. I am a Florida girl all the way. I can't stand the sun. I am not a beach girl, and I am maybe 20 minutes from a beach. I I see myself in another life living in like a snow area, but even on the one time that I did experience snow, I had no idea what to do with it, like by any means. It was beautiful to watch, but this Florida girl, I only know hurricanes. I don't know blizzards. But no, outdoor, I'll go to a pool, I'll go to a water park all day long. But as far as the beach and the sun and the sand, too much.
When I say I love water, I love moving water. So if it's a lake, if it's a river, if it's the beach, if it's good for me. It's good for me. It does something to me. I'm not even sure what. Well, I'm an island girl, so I guess that's why. But
Yeah.
I've always said I can't live anywhere that's landlocked. I just know it. I go to Vegas or someplace, and I'm like, I need to go home.
Yeah, Vegas is not the place for you at all. That might be your kryptonite. That is not going to work out for you
No.
whatsoever. Well, you're more than welcome to come to Pensacola. We have the entire Gulf of Mexico out there for you, so you are more than happy to hop in for sure.
Yeah, but that's the thing though. I've been asking people about self-care because as you say, it's become a buzzword and we never really identify what it means to us.
Right.
And it's not always I say all those things that I like to, but it's not always a big thing. And in fact, for most of it, I think it's not a big thing. It's
It's not.
just the thing
It's
that,
the thing.
it's the
You're supposed to do it. It's like going to the gym. You're supposed to do it. You're supposed to eat
yeah.
right. But as we said before this call starts, life happens and
Happens.
making time for that for some people can be just a challenge,
Yeah.
whether it's a financial challenge or a time constraint challenge. But we know we should. And in this role, I would say, especially with my ER nurses, ICU nurses, like you have to have a minute to really decompress, or you tote this stuff around and you think you're fine. Everything's fine. You smile and nod until
Yeah.
it's not fine. And whatever that not fine ends up being, you got to
Yeah.
address it before it
Yeah.
addresses you.
Yeah. Yeah. You have to recognize it and address it. Yeah. Yeah.
Yes, ma'am.
Thank you so much for this conversation.
It
It
was so
has been
much fun, Miss
such a
Dale.
pleasure.
Absolutely. I did. I was very much looking forward to this and I really enjoyed it. I could talk about residency and new grads. Just that has been the past 6 years of my life. So anytime, honey, you want to
Well,
chat,
we'll,
you just
we'll
call.
do this again. We'll do this again. Thank you so much.
Yes, ma'am.